Hi, it's Dr. Steve Weiner from the Aesthetic Clinique in Santa Rosa Beach, Florida. I'm very excited to introduce a new procedure called KeraLase. And it's a combination of KeraFactor, which is for hair growth, and the LaseMD Ultra, which is a laser. And the laser, what it does is, it's very important in this process, and we're doing it right now. It punches microscopic holes in the scalp to allow penetration of the KeraFactor, which is a serum. So this procedure is done without any topical anesthetic. The laser portion probably takes approximately 5 to 7 minutes. And we go in the areas of hair loss, but we're also going to go in areas of the scalp that doesn't have a lot of hair. And what we're trying to do is we're trying to improve the entire scalp health, not just the areas where there's no hair or minimal hair. And we do a couple passes with this. It is the most powerful thulium laser on the market. We typically use it also to treat pigmentation and fine lines and wrinkles. And again, it's a minimal downtime procedure. It's non-ablative. So an ablative laser is going to be much more aggressive. This is called a non-ablative laser, where it heats up the tissue. And this is a very superficial laser. It goes about 250 microns, which is 0.2 to 0.25 of a millimeter. So it goes very shallow. It can be done on all skin types, this laser, so that's unusual too. And so we can do this on men and women. Women are probably going to have a little bit better response. This is typically done in a series of 6. We separate it out by 2 weeks. There's no restrictions afterwards, and they can wear a hat, work out. What I do recommend is that people don't wash their hair till the following morning and leave this KeraFactor on the hair to allow for penetration.
It's very comfortable. You feel some warmth. That's really it. Maybe just a little prickly, but
right. The LaseMD has been shown to increase the penetration of the KeraFactor by 7 times. So 700% improvement when you use the laser versus just putting the KeraFactor on the skin. But the KeraFactor has something called nanoliposome technology, which allows it to penetrate down the hair follicle shaft to the areas of the growth centers much better than without it. So what we're doing right now is we're massaging it into the scalp, into the areas that we did the prior LaseMD. Prior to this, we had been doing a lot of PRP for hair growth. We've been doing it for about 5 years. So PRP is both highly variable. It varies from patient to patient. But there's also recent literature that suggests that if you take aspirin or Motrin or any of the non-steroidals, that the quality of the PRP, the ability of the platelets to release their growth factors significantly decrease. So you get rid of all those factors when you use KeraFactor, which is a synthetic product. It's off the shelf. There's no human contamination issues, but it's also consistent. And what they did is they looked at the PRP growth factors, and they found that there were some that were very positive for hair growth, but there were some negative for hair growth. And so that limits the ability of PRP to help hair. So what they did is they amplified the good growth factors by 50 to 1,500%. And they got rid of the negative growth factors that are inhibitory, that cause inflammation and inhibit the hair growth. So KeraFactor is all the good products, amplified, much better than PRP. They're off the shelf. They have the nanoliposome technology. And they got rid of those inhibitory factors. They also put in a few proteins as well that are good for overall scalp health. So as you can see right here, we have a very happy patient. Very easy procedure. The hair is wet. Keep it on the skin till the following morning.